Welcome to Morning Grounds, Morning Rounds, the series where we highlight the people, partnerships, and ideas shaping the future of Stony Brook medicine. Today we're talking about something that touches every patient and every community we serve, the future of ambulatory care. Ambulatory care, the care patients receive outside of the hospital in outpatient clinics, specialty centers, and community-based settings, is one of the fastest growing and most important areas of modern medicine. And at Stony Brook Medicine, it's at the heart of our strategy to deliver exceptional, accessible care across the region. Dr. Todd Griffin, our Vice President for Clinical Services, joins us today to share his vision for where we've been, where we're going, and how we're building a system that puts patients first. So, grab your coffee, settle in, and let's get started. Welcome, Todd. Thanks for joining us.
Thanks for having me, Dr. Wertheim.
So, talk to us a little bit about ambulatory care. What's meant by that? Why is it such a central focus in health systems like ours?
So ambulatory care is really care that's delivered in the office setting or truly outside the traditional four walls of a hospital. And that has really evolved over the last 10 or 15 years. Many things that we would only have done in a hospital previously, certain procedures, certain types of treatments, et cetera, are now being delivered in the ambulatory setting. And so we have to actually evolve the different facilities that we have that can do that. In addition, we're really looking at how do we do better from a coordinated care perspective? How do we actually deliver timely care for our patients in a high quality manner?
That's great. So can you give me some examples of what kinds of care we deliver now in an ambulatory setting that formerly we delivered in a hospital?
Sure. So even when you look at first of all, the more sophisticated things like ambulatory surgery used to be really done on the grounds of the hospital. Now we're moving that into our facilities like COMAC that'll be opening this fall. Many procedural things such as endoscopy, colonoscopy, things that need to be done in a much more efficient manner. And even other procedures where we're looking at how can we do things that are more comfortable for patients. There's many things that we were doing in an office setting that might be very uncomfortable because we didn't have anesthesia or other ways of sedating patients. But being able to do these in our newer procedural units will actually be very helpful. In addition, infusion care, there's so many different medications now that are being delivered by infusions that being able to do them in a setting that's closer to the patient, making it easier for them, more accessible. These things are all important.
Great. Thank you. I know that patients increasingly want care that's convenient to them as well as comprehensive. How is Stony Brook Medicine addressing those interests?
So that's really important. I think, first of all, many people don't realize where Stony Brook Medicine is. Even our staff, our patients, our providers don't realize that we actually have more than 200 outpatient sites, 200 places throughout Suffolk County and even into Nassau County where you can get seen for care. But one of the things we're trying to do is really organize that care better. Much of what we had done in the past was creating offices in locations that we thought were appropriate. But now we really want to go more to this, what we call a hub and spoke model. So the hub is very large facilities that have pretty much most of the specialties that we have. So if you think about our COMAC facility, our advanced specialty care at COMAC, or advanced specialty care at Lake Grove, pretty much we have every specialty as well as those other services that we've been talking about, those advanced services like infusion, procedural units, ambulatory surgery, and even clinical trials units for us to be able to do research, et cetera. And then we're surrounding those with what we call spokes, which is going to be more our primary care, pediatrics, women's care that will surround those and allowing those to be closer to patients geographically, and then having those specialty hubs still geographic so that patients don't have to travel always to Stony Brook for that care.
That's great. I think that'll be very well received by our patients. Are there specific geographies or populations or service lines that you think are really worthy of focusing in on right away?
Yeah, so I think when you look at Stony Brook Medicine in the past had not really focused on primary care access. And so we've really tried to grow our primary care access because that's what most patients need. That really helps drive our preventive services. So hopefully they never need specialty care. So we're really looking at how do we grow our primary care specialties at the adult level and also at the pediatric level to support our children's hospital. But in addition, we know that there are many specialties where access is still an issue. When you think about endocrinology, rheumatology, immunology, even some of our more advanced services like cardiology, GI, et cetera, there still needs to be more providers. We know that our data shows that there's a lack of providers even in Suffolk County. Many of our surgical specialties, ENT, vascular, et cetera, we need to be able to grow. And then for everything, really mental health is important. So growing our psychiatry programs. So we're really growing in a number of different areas. And I think we're really looking at our data to help inform that.
So that's a good segue to my next question is, what are some of the key factors that help you determine where we grow next and in what areas?
So we use very sophisticated analytics, first of all, to look at our own performance so we understand what our access issues are. So how long does it take a new patient to get seen? Okay, that's really important for us. We really want patients to be seen within 2 weeks if they're coming in as a new patient. If they're a cancer patient, we want them seen within 72 hours or even same day or next day if possible. So we're really looking at those measures to understand where we need to grow specialties or become more efficient. And then we're also looking at zip code analysis to understand where patients are coming from. So if we see that a large cohort of patients are traveling far distances to get to a certain specialty, we want to say, okay, how do we place those specialties there? How do we think about consolidating some offices in that space, create a larger space, and then create accessibility for the patients?
So one question that comes to mind as we think about dispersing our footprint across the county, how do we make sure that we're maintaining an exceptional level of care across all of our sites?
Yeah, so that's really important. So, the high quality care is sort of, I feel like everything we do at Stony Brook Medicine. And so when we bring things together, we're really doing a number of different things. One, we're looking at all those different metrics. We have very sophisticated metrics that allow us not to look at not only access, but also the quality care that we deliver. And that's done through our clinically integrated network, as well as our accountable care organization, where we look at how are we doing from a diabetes perspective? How are we doing from treating hypertension? Are we treating mental health disorders such as depression, et cetera, well? Are we getting people in for their preventive screening? And are we doing the cancer screening that we need to be doing when you think about colonoscopy, mammography? So we actually collect all that data and we can actually feed it back to every individual provider by site to see, are we providing the care that we want to deliver? I think that's really critical. I think having that type of report cards is really important for our providers and for our patients to know that we're delivering that high level care.
That's great. And I agree with you 100%. I think people need to get the data on their own performance to be able to recognize where they can make improvements.
And sometimes it's actually we've provided the prescriptions, we've done the different lab tests that are supposed to be done for the patient, and the patient for whatever reason gets distracted, doesn't follow up, and it's actually we follow up with those patients and make sure they're getting it done because patients get busy just like we do.
Sure.
So sometimes the doctor's doing the right thing, but the patient lapses for whatever reason. And so us reaching out to those patients and helping them, I think is really important.
Yeah, life gets busy and we all need a little reminders periodically. So one of the other things that I think relates to this is how we're incorporating technology into the services that we provide for our patients. When you talk about making it convenient for patients, I think technology can play a role. Talk to me a little bit about how technology, in your view, should be incorporated into the ambulatory setting.
Sure, it's really critical. I think since COVID, we've seen an explosion of telehealth, right? And telehealth has really allowed for improved access for patients. It's allowing us to avoid having patients to drive in to get seen. There can be multiple different specialties that have really benefited from this. One of the most important ones has been mental health. That has really exploded from a telehealth perspective, and we've been hiring as many psychiatrists and psychologists and social workers as we can because of the needs for mental health services throughout Suffolk County. In addition, we've developed our virtual immediate care. Think of it as a virtual urgent care. This is really also very critical for patients. Many times patients have an issue and they're unaware, do I need to go to the emergency room right away? Or, can I just wait to see my primary care provider tomorrow? Or is this something that can be easily treated through a telehealth visit? So having emergency room physicians staffing a virtual immediate care allows patients to to figure out what do I need to do, and they can help guide them, which I think is really important. And then when we look at how AI and other things are impacting care, it's been wonderful. Most of our providers now have the ability to use AI scribing, which allows the providers to actually have more face-to-face time with the patients as opposed to trying to document their notes or interact with the EMR. We're going to see that AI is going to help with a lot of what we call pre-visit planning. So, you're a primary care provider. When your patient comes in, you want to see, did they have their mammography? Did they have their colonoscopy? Have they done their different blood tests that they need to be doing? But if AI can search the electronic medical record and pull that information for you, it really cuts down on the amount of time you or your staff is spending finding all that information so that you can make sure the patient's getting all those things that need to be done from a high quality care perspective.
That's great. That's very helpful. I can tell you as, a clinician, using the AI scribing is life-changing.
Yes.
Because instead of me staring at a computer screen while I'm trying to listen to the patient, I can put the computer screen away and focus right on the patient, which is what we want.
And we had too many providers who were doing what we call pajama time, spending time after their hours, writing their notes, doing their documentation. And again, it's better to do it in the moment to be able to make sure you're documenting everything. And it's also from a wellness perspective, really important for the providers to be, when their day is over, to hopefully be able to spend that time with their family.
Right. I think that's great. Um, what innovations in particular do you think you're particularly excited about that maybe we haven't touched on yet?
When you look at different things that we're doing, I think the way we're going to be able to interact with patients, we've been a little slow in what we call the digital front door for patients, meaning the ability to self-schedule. I think that's really going to be critical for a patient to be able to self-schedule their different testing, okay? As well as our ability to reach out to patients, whether it's through texting or other methods, for them to be aware they're due for testing, that they need to follow up with their doctor. I think all those things are going to become really important. I think also, when you look at the technology and how it's going to be able to inform the provider and or their patients about what to do next is going to be important.
Great. Great. Now, if we have a footprint that really spreads across Suffolk County, which is such a large geographic area, we want to make sure we're recruiting workforce, but having them understand what the culture of compassionate care that we're trying to put forward here at Stony Brook Medicine is. How do you build that sense of culture amongst a very dispersed workforce?
Yeah, it's really important. So there's a number of different ways. First of all, for any new employee, we need to be hiring for success, right? We need to be hiring the right people who really match our culture and our ideals, right? And that becomes part of the interviewing process. That's really important. We then actually instill that in orientation for new employees, where we start talking about our I care values, what those mean, how we do compassionate care. We also need to be, for our existing employees, looking at our Press Ganey surveys, understanding the voice of the patients and understanding where we're providing great care, where maybe we're not meeting what we expect, and then how do we actually re-educate for those employees. It needs to be a constant, reminder about why are we here, why are we doing it, and understanding that everybody who's coming through the door, it's like it's our family member coming through the door.
Right.
How do we want our mother or father treated, or our brother or sister, or our son or daughter treated? I think if we come to it with that mindset, I think patients have the great experience. In addition, though, we have to create the right experience for our staff and our providers. If we create the right environment for them, and we're creating, the different technology and other things that we talked about, they're going to provide the right care for our patients, right? So it's really important that not only creating the right environment for the patients, but also for the employees and the providers.
Great. That's wonderful. In your view, how does Stony Brook Medicine's I care values show up every day in the work that we do?
Well, I think it's like we said, it's really about understanding the voice of the patient, right? So it's about, first of all, it's making sure everybody understands what the I care values are. I think two is it's constantly reminding people through the voice of the patient so that we can highlight those areas where excellence occurred. I think it's really important to, pat people on the back when they do great, but at the same time also correct behavior when it's not appropriate. But I think most of the time when our providers and our staff falter, it's because of they're dealing with too much at once. And so how do we make sure that they have the proper amount of help to make sure the patients get the right experience?
That's great. I think a lot of what you're describing also tie into something else I want to ask you about, which is your views on recruitment and retention of
Mhm.
excellent staff, because I think that's sort of
Yep.
the pinnacle of compassionate care and people feeling engaged and people feeling valued. What are some of the things that you think are important in
Well,
those things?
you said it right from the start. Staff, providers have to feel valued.
Mhm.
And that comes in a number of different ways, right? So, first of all, we have to constantly be looking at what we're doing from a compensation and benefit perspective, right? Are we appropriately compensating our staff, our providers? Do we have the right benefit structure that makes it competitive? And that's constantly looking out into to the environment of our local environment, understanding what are the pressures that are affecting recruitments around different types of staff, whether it's a nurse, whether it's a medical assistant, or whether it's one of our doctors. In addition, it's around, like I said previously, it's about creating the right environment for them and getting everybody to work at their top of license, so to speak. We
Mhm.
want doctors to be doing doctor work. We want nurses to be doing nursing work. And we want everybody else to be doing the work that's appropriate for what they're doing. In addition, we need to create opportunities for advancement. People leave sometimes not because of compensation or because of the work environment, because they have the opportunity to advance somewhere else. So how do we create that advancement within the organization? How do we help people to advance their careers? How do we help a medical assistant become an LPN or an LPN to become an RN? How do we help a provider to become a division director or take on other leadership roles within? And I think the school has done a great job creating different leadership academies, creating different things for early career and mid-career, and we've been trying to develop those actually for our staff members as well.
And I know that you've been intimately involved in a lot of
Correct.
those activities, so that's really great. Um, when we talk about bringing care closer to where patients live, how does that influence the types of locations that you choose to establish a new site?
Yeah,
Medical
I
center?
think there's a number of things we look at. One is, as we said before, where are our patients coming from? Do we have a site there or not? I think the other thing that really is important is we are a safety net hospital. We do. It's really important for us to take care of our underserved populations. Suffolk County, unfortunately, does not have great public transportation. So when we're looking at sites, some of the things we're looking at is where can we be that's going to be important from a public transportation perspective. And some of the reason we chose our site, our major hub at Lake Grove, was because it sat on the mall where there was public transportation. So if there's not public transportation available in certain areas, then we have to really have a site that's in those areas.
Mhm.
And we're in the process now of moving one of our sites into Central Islip. That's going to be important for that population from a pediatric and obstetric perspective to have closer access and not, if someone doesn't have public transportation, doesn't have a car, to take 2 or 3 buses to see us. I think that's really an important thing. So some of it is based on the needs of that community.
Mhm.
And then some of it is based on what we're looking at from an opportunity perspective of where we see that there's, opportunities for growth, certain services.
That's great because we do have very diverse group of communities in Long Island, and not everybody does have access to
Correct.
a car or a variety of different other obstacles. So, understanding that benefit for health equity is really important.
And even for those areas where we don't have a site, we've developed the mammography van. We have the dental van. We're looking at all these other things that might be helpful for us to have these mobile approaches to go into certain areas or neighborhoods where we don't have a site in the short run. And I think that's an important thing that we offer as well.
That's great. That's excellent. Now, I know you grew up in Sayville.
Yep.
You're a
And you in Huntington.
and I grew up in
Yep.
Huntington. And I've teased you about being a South Shore kid. I'm
Yes.
the North
Yes.
Shore kid. But how do you feel, since you've spent so much of your formative years and your adult years in Suffolk County, how do you feel that informs your connection to delivering care to these communities and how you think about the communities we serve?
Yeah. I mean, listen, I'm invested in Long Island. I'm invested in Suffolk County. I want people of Suffolk County to think of Stony Brook Medicine as the best, right? That they got the best experience. So when I hear that a patient didn't have a great experience or that our facility is not meeting the standards that I would expect, to me, that's really important. That's something I want to correct because I want my neighbors, my friends, everybody to say, why wouldn't I go to Stony Brook Medicine? And I think that's an important thing. You know, as someone who also grew, as we talked about, grew up on Long Island, Stony Brook University Hospital or Stony Brook University were sort of afterthoughts to some extent 30 or 40 years ago. And seeing how it has grown over the last 30, 40 years, it's unbelievably impressive what Stony Brook medicine has become. When you think about the 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 hospitals, right? And we're
Mhm.
multiple hospitals now, we're multiple ambulatory sites. The collaboration with the university has exploded over the last few decades. And really that ability to marry the academic mission and the clinical care mission, we're at the forefront of doing so many different things that I don't think many Long Islanders know, right? There's so many great things that have happened here, so much great care that we're delivering at Stony Brook Medicine that, I'm so proud of. And I'm hoping that, everybody else in Suffolk County and Long Island is as proud as what we are.
Well, I'm certainly proud, and hopefully the rest of the county is watching this and they're hearing about it. Well, that wraps up today's episode. Thank you so much to Todd
Thank you
Griffin
for having me.
for sharing his vision and for the remarkable leadership that he brings to the future of ambulatory care at Stony Brook Medicine. His insights remind us that the future of healthcare isn't only built inside hospital walls, it's built in the clinics, the communities, and the connections we create every day with patients and families across Long Island. And to all of you across Stony Brook Medicine, thank you for the care and commitment you bring to your work and for helping us build a system worthy of the communities we serve. Until next time, keep the coffee brewing and the care flowing at Stony Brook Medicine.